Hello. So today I just wanted to tell y'all about my dream career, what I would want to do for the rest of my life. So something that's been a passion for me for a long time in various ways has been the field of medicine. Whenever I was younger, I really wanted to be a veterinarian, and then I wanted to be a doctor. Now that I'm older, I want to be a nurse. Specifically, I want to do oncology nursing. So there's a huge need for nursing care, and that is growing all the time. A lot of our older nurses are retiring, and the population's getting older because we have better health care, so people are living longer, and so there's a need for that care in the older population. And so, specifically, I want to talk about what an oncology nurse is and what they do. So oncology nursing, you specifically deal with cancer patients. And you can specialize in different ways. There's pediatric oncology, there's hematology oncology, there's geriatric oncology, and various levels of that. And so you have two main sort of types of duties as an oncology nurse. And first and foremost of those is the physical care of the patient, right? You have to actually go out and care for the patient, and that includes administering chemo, doing assessments on the side effects of the chemo, looking at the lab results of the different scans, and helping the doctor figure out what's going on with the patient and institute the care that they need in order to be able to recover. And obviously that's very important, but another side of that is that with oncology patients, they're usually there for a long time. Someone can have cancer treatments for months or years, and so you end up seeing these patients over a long amount of time. And so that's where we get into that psychosocial care, which is a lot more about being empathetic and helping the patients deal with things like anxiety and depression and their feelings about their illness. But in addition to helping the patient deal with those feelings, you are also helping the patient's family. Because the family of the patients, while they're involved in every aspect of nursing, they're especially involved whenever it comes to oncology because it is such a long-term thing that happens. And, obviously, not everyone can be an oncology nurse. There's a bunch of different requirements that you must meet. So, at the very least, you need to have your either a 2-year associate's degree in nursing to be an RN, or you need a 4-year BSN, or further training like an MSN or an advanced nurse practitioner, which would be a master's degree program. The most competitive way to get into oncology nursing is if you're a BSN, but at this time, because there's such a need for it, according to the oncology nurse career guides that I looked at, they've been accepting people that only have a 2-year degree. And so you can also get separate certifications in oncology. There's hematology oncology certifications, pediatric oncology certifications, and those require you to have worked as a oncology nurse for at least a year and to have done at least 15 hours of administering chemotherapy or something along those natures to be certified in that. So let's get into why I actually want to do this. Now, it's long hours, away from your family a lot, and you're dealing with some very, very sick people. So why would I actually want to do this? Well, most of it is because you're able to have a direct benefit on people's lives. And so in my clinical experience in the RN program here at MAC, my favorite part of that was getting to spend time with my patients and care for them, and I liked getting to know them. And it's hard whenever you're just working on the floor, working in the ER or something like that, because you only have them for a couple of days, maybe a week or so, and then they're gone. But with oncology patients, you get to work with them for a long time, and you really get to have more of a hands-on approach to their care. And second, you make a pretty good amount of money. According to the sources that I looked at, the average range is between 47,000 and 103,000 per year, with a median range of about 68,000. And so, at least you're going to be pretty well compensated for doing that. But in conclusion, I just wanted to, kind of refresh what we've been talking about the duties of an oncology nurse, what they do, why they do it, what you have to have in order to do it, and why I personally want to be an oncology nurse. Thank you.